The Human Optimization Podcast is proudly brought to you by Vicon Supplements, where quality meets sustainability. Vicon's all-natural supplements are handcrafted and sustainably produced in Canada, bringing you products that nourish both your well-being and our planet. Visit ViconSupplements.com today and be a part of a greener, healthier future.
Are you ready to embark on a journey to the best version of you? Join me, Lisa Pitel-Killah, as I dive deep into the world of hair tissue mineral analysis and functional medicine with fellow experts, and guide you on the path of unlocking your full potential. As a multi-time kettlebell sport world champion, I'm on a mission to reach high-performance professionals from around the world to help you minimize tiring symptoms, maximize health, and gain unstoppable energy. This is the Human Optimization Podcast. Welcome, everybody, to a brand new episode of the Human Optimization Podcast. And I have Cris Duval here with us today. She is a patient health advocate and wellness coach. She spent more than 4 decades in patient care. As founder of the LifeGuard Approach, and we're going to talk about that today, Cris focuses on helping dental and medical teams shift their mindset from repairing the damage to preparing patients for health. Cris describes herself as an architect of change in the dentistry's approach to oral systemic health. Her ultimate goal is saving lives by both guarding and guiding health and wellness. Welcome to the show.
Thank you so much. It's great to be here.
I am super excited. You know, we were talking before we hopped on here just about oral health and the great importance of that, and how maybe people don't necessarily realize why it's so important and why to be your own advocate. Now, over 4 decades, so many things have happened in that period of time, right? And I always love asking guests, how did you get here?
Oh boy. The real story is my experiences as a child. By the time I turned 18, let me tell you about that, and then I'll back up a little bit. By the time I turned 18, I had lost 2 brothers, and our father had passed away. And that was so traumatic for me to see a family, including me, that just lived with grief for a long, we still do.
Yeah.
But I managed to decide, how could I positively impact my family? So I became what I call the risk management warrior in the family. And so whenever we go and do something and my family says, oh, we love to go places with you, you do all the worrying, but I don't worry at all. I just manage what could be risks so that something doesn't happen to my family.
Yeah.
And then back up from that to age 14, I was a competitive swimmer. And I swam a race one day at my home pool. And when I won the race, I turned around and leaned against the back of the pool and waited for the other swimmers to finish. And as I did that, I blew a great big bubble. I swam the race with 4 pieces of double bubble gum tucked underneath my tongue. And unbeknownst to me, the lifeguard who knew me and the timer in my lane was a physician. They met me on the way out of the pool, and they stopped me and they asked me if I wanted to live to be an adult.
Oh,
well, I thought at the time, well, that's kind of a stupid question. So I do. And they said if I had aspirated that gum during the race, I would have gone dead in the water, and I probably would have died because they would have known what had happened to me.
Right. Yeah.
So they could have let me walk out of the pool area and say, just stupid girl. But because they were in relationship with me, they cared enough to do their job.
Yeah.
And so I decided after those 2 events in my life that I was going to be like a lifeguard for my patients. I was going to guard and guide their health and wellness. And so it became my passion to learn as much as I can about what our patients do, their lifestyle, whatever, how it impacts their health and wellness and the length of their health span. So, yeah.
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 Well, because in the grand scheme of things, it's not just about the number of years you're here, it's the number of years you're here and are healthy.
That's your health span. Yes, you are so right.
And so tell me where the LifeGuard approach really is that proactive action with regards to, and again, I think nowadays it's actually more important than ever. I feel like even in the past, 4 or 5 years, it's more important than ever to practice being your own advocate, right?
Absolutely.
And so, and give a little background on that, just with regards to how you help people kind of transition into taking really that approach on their health and their life.
Well, I do it very differently. The first thing I did was I gave up the stranglehold that traditional hygiene had on me, which was I just focused on scraping calculus or tartar off of people's teeth.
Yeah.
Because I knew, because the science had evolved so much, I knew that wasn't how we were going to help patients. That wasn't how I was going to help save their lives.
Mm-hmm.
So I focused on 2 things. I decided I was going to be that risk management warrior that I told you about.
Mm-hmm.
And I was going to combine that with being a values hunter.
Oh, and so
patients.
explain this.
Okay. Well, every person just about that sat in my chair had some risks. There could have been just one or none, and how to keep it that way. Or there were a lot, the 3 main diseases and problems that kill people in America today are number 1, heart disease, number 2, cancer. And do you know what the 3rd cause of death is?
I could guess. Tell me.
Medical error.
Oh, I don't think I would have guessed that one.
No, I didn't either. But when I realized that if I was going to stay in that stranglehold that traditional hygiene was doing for me, I was going to be placing my patients at risk of medical error.
Yeah.
Because if I wasn't screening for heart disease with blood pressure and other questions, knowing what their family history was for heart disease, if I wasn't doing oral cancer screenings on every patient at every time, I was committing medical error. So those are the things that would just drove me forward. Now, so I would take those risk factors that somebody had, and I would combine them with, I wanted to know what their values were so I could help the patient understand that I was concerned about mitigating that risk. And I was going to do it in a way that they would make that choice for themselves. They would choose for themselves what they wanted. So to give you an example, I shifted my questions from how we used to focus on calculus removal to what my patient valued, because I knew if I found a risk factor, if I could link that and marry that risk factor with what they valued in life, that I had a bigger chance of helping them become an advocate for themselves.
Right.
So I would say things like, as we're walking back to my operatory, tell me about something great in your life. And never once did I hear somebody say, oh, I just took a big check to the bank. It was always, I just had my first grandchild born. My wife had been given a clean bill of health for cancer. My kids are moving back to the area where we live.
Yeah.
And so because I knew what they valued, I could help them become their own advocate and mitigate those risks and get what they wanted in life.
Makes total sense.
So it's all about being an advocate. really, truly, for me, it's about asking new questions. Like,
Yeah.
I gave up on asking, do you brush and floss? Which most hygienists will ask their patients.
Mm-hmm.
I don't care about that. What I want to know about is, tell me about when your gums bleed,
Mm-hmm.
because bleeding gums are the key. If you can reverse that, that's the key to health and wellness.
Mm-hmm. Yeah, absolutely. Well, and talked about, disease, right? We talked about a little bit about, just removing the calculus, but then getting deeper. I am definitely an advocate of oral health
Mhm.
because it is the beginning of how our body gets infected with different bacteria, potential infections. Give a little background on that because I really believe a lot of times that even sometimes as functional practitioners, we're trying to find the cause of something and sometimes it ends up in the mouth. And people don't even realize.
Yeah, or it originates somewhere else and then travels to the mouth.
Mm-hmm.
Um, I think today, if somebody wants to be an advocate for themselves and be on the leading edge of how you should be taken care of, there's one thing that I think is the key to it. And this is what I used 20 years ago. I started doing oral DNA testing or bacterial testing for pathogens.
Oh, that's interesting.
So
Okay.
because we now know there are 5 pathogens that are pretty much causal, they now know, to cardiovascular disease,
Mm.
because everything's about inflammation, right?
Yep.
And so when you have these 5 pathogens in your mouth, and that's combined usually with a couple of other bacteria, but they become synergistic with each other.
Mm-hmm.
These bacteria, they create gum inflammation or gum disease. They cause your gums to bleed. That's your biggest indicator. And when your gums bleed, these pathogens travel from your mouth into your vascular system. And they do in your vascular system exactly what they do in the mouth. They create inflammation.
Mm-hmm.
And so finding out if you have these pathogens and then figuring out a course of how to get rid of them
Yep.
is critical. And I think that's the main thing that I would encourage people to really understand. If your hygienist and dentist don't do pathogen testing,
Mm-hmm.
there's a huge number of companies out that are doing it now.
Mm.
Have them request it, literally request it. And it should be checked every year or so, because here's what we now know. These pathogens, the route of transmission is from mothers, lovers, and dogs.
Dogs. Oh, goodness. Our furry friends.
Yes, letting them lick your face,
Yep.
letting them drink out of your glass. I was at a party one time and this lady was giving her dog, letting him drink out of her glass. And I thought, that's interesting.
That's a bit, I love my furry animals, but that's a bit too much for me. Oh, I share many things, but that's not one of them. Definitely.
Yeah, and there's a lot of times now I'm trying to talk into some of these home medical testing companies where you can
Mm.
order a test in
Yep.
to definitely do these, because there's a lot of dentists and hygienists out there, I'm sad to say, poo-poo this information. But
Really.
it is the most important thing, balancing that biofilm.
Hmm.
And it'll help from other aspects too, from a cavity aspect.
True.
So, because cavities are caused by the acid produced by certain bacteria. So you can
Hmm.
find that information out too if you have um, a high caries rate. So
Yeah.
especially it's great for children, but it's not uncommon to test someone and then we get things cleared up, they're gone, and then say the guy gets a new girlfriend.
Mm. Hmm.
And so then some of these bad guys reappear. So You just
Well,
have to be on it.
yeah, and even thinking about this comes up a lot, with H. pylori, for example, just thinking about the fact that the transmission's so easy that if you have one person in the family who tests positive, right, and has these mouth pathogens, you've got to treat everybody because
Oh,
the chances of them having it are, very, very high, right? Yeah.
yes.
Mm,
And especially, I've done a deep dive into esophageal cancer and some
mm,
of those
mm-hmm.
different diseases and cancers. And what they're finding is oftentimes, most oftentimes, there are these pathogens near the and in the tumors, especially metastatic
Wow.
tumors
Yeah.
that are around.
Mm,
And with relationship to H. pylori, we have so many people that are self-prescribing PPIs, proton pump inhibitors, and that's a real danger for
yeah.
H. pylori.
Yeah, absolutely.
Changes what's going on how our body would naturally get rid of H. pylori. If there's not enough stomach acid there, they're
Yeah.
in trouble most often. So
Yeah. Yeah, absolutely. So interesting. And what would you say, like, what would be one of the common things that I guess so somebody's listening to the show, that's what this is all about, right? Bringing about information that they can be able to execute and help themselves. And so, what are some of the questions that first off, actually, let me backtrack just a little bit. With regards to, let's say, biological dentists, do you have like, do they end up doing a lot more testing and things like what you're specifically talking about, being a little bit more proactive rather than like a traditional Western medicine dentist?
yeah, they can. The biological hygienist
Mm-hmm.
and holistic dentists are another one
Mm-hmm.
group that
Mm-hmm.
will be more inclined to um, look for those. What happened to me when I quit my job because I was burned out, or at
Mm-hmm.
least I thought I was burned out, but I'd
Yep.
lost my impact and influence with my patients
Mm.
because what I was telling them to do wasn't working. And
Right.
so if your hygienist is still telling you just you need to brush and floss more, realize that that is not going to help. We now know that it takes more than that to get yourself healthy.
Mm-hmm.
And so I'd really focus on if you're having problems and challenges with bleeding and gum disease, start asking your hygienist, number one, will you partner with me?
Mm-hmm.
It's important for me that I want to be healthy and rank my general health or my dental health on a scale of 1 to 10. Where do you see me sitting?
Yep.
And I want to change that for the better.
Mm-hmm.
But I think one of the most important things too that I can suggest to hygienists that want to start moving in this direction and dentists
Mm-hmm.
is I have to know the answer to a certain question before I can begin to walk into a room. And if I don't know the answer to this, you might as well take a 3-inch piece of duct tape and put it over my mouth because I won't know how to talk to them because I'm not going to assume what's important to them.
Mm.
That's what we do is we make huge assumptions about what's important to our patients. But the question is, tell me about what you want for yourself.
Mm. That's a
Because
very good
I
question.
know that patients want one of two things.
Mm-hmm.
They either want to move toward the benefit of health or they want to move away from the consequences of disease. And so all I need to know is which one of those they are. Now, how I treat them clinically with ozone and lasers and all that is exactly the same.
Mm-hmm.
But my message to them is totally different
Right.
because I frame it around what they want.
Mm-hmm.
And those things I think would help patients get more reward and start being an advocate for themselves.
Yeah. And you mentioned what would be, and again, we're not here to promote any type of um, monitored supplementation or implementation of strategies or anything, but you mentioned ozone. I find that interesting because ozone can be very powerful. what are some of the tools, again, just from a very general perspective, that sometimes you use to be able to be proactive with some of these situations, especially if there's pathogens present?
Well, let me start with this. Most people are moving towards being antibiotic adverse.
Mm.
And we choose not to use antibiotics. There are some indications for antibiotics that it's important.
Mm-hmm.
But, dentistry is one of the bigger, not contributors, but we use antibiotics a lot and have in the past. And the last thing we want to have happen is one of our patients gets C. diff or
Right.
something like that from,
Mm-hmm.
So Dr. McKay, that's who I worked for the last 20 years,
Mm-hmm.
he challenged me to become to paint a bigger canvas of who I could be for our patients. And that to me, I heard him say that he wanted me to start a wellness program. So I started researching and learning about what other modalities out there could get our patients healthy besides scraping and polishing teeth.
Yeah.
So I first started using a diode laser, which is great because it could literally remove the infection in the tissue and jumpstart the healing. And then I learned about ozone, gas, water, and oil.
Yep.
And so I started using that because it literally kills bacteria, pathogens, parasites on contact, and there really aren't any downsides to it.
Yep.
So that's two of the things that I use consistently on every patient at every visit. And so
Wow.
it really made a huge difference in, really all we have to do is give our patients what their body needs to heal. And that's oxygen and water in the right form so that their body can heal whatever is going on in there. So those other types of things, other than just throwing antibiotics at everyone, we really found value in.
Well, and you have to think too, again, you mentioned, our bodies are evolving, right? We even see this in animals where they become antibiotic resistant, even with dewormers and things like that. And a more natural route sometimes is just more sustainable and can bring about the same results in many cases, right?
Yes. And I'm anxious to learn from you about what you're doing with animals, because you're taking a new approach to how to keep animals healthy. So I have some family that they're two girls, at least one of them is very heavily involved in high school rodeo.
Yes,
And,
yes.
keeping these highly functioning horses healthy is a big
Big
deal.
challenge.
Yes.
It is. They have huge demands called upon them, and a lot of times, just even given obviously the herbivores, there's a lot of missing elements, if you will. So yeah, it's been an interesting journey. And even coming back around to oral health, I was sharing earlier. I have a little Chihuahua. He's almost 16. He'll be 16 in a few months. And he still has quite a number of teeth left. And so I still make sure he gets his teeth cleaned, because little ones tend to have that buildup of plaque. And then we end up having, could have kidney problems because of that bacteria that they're constantly digesting and things like that. So again, just coming back around to how important it is to really pay attention to, again, not only what you want for yourself, being proactive with your health and again, your health span, right? But also implementing some of the tools. And I will say too, I'm a huge fan of ozone. I think there's so many capabilities with regards to what it can bring to the table, to support people for many different, conditions and issues. Yeah. So that's really interesting.
Yeah.
And so tell people how they can work with you and your team, and how they can kind of tap into the LifeGuard approach and take control and be their own advocate?
Whoa. I've always gone from the side of how I can help dental teams, but I'm also finishing a book right now. It's called The LifeGuard Approach.
Love it.
Why compassion necessitates life-saving screenings. I think being proactive, if you go and see your hygienist and she does not do an oral cancer screening or take your blood pressure or test for the health of your biofilm, there's tests that we can do now, tests for the pathogens. You need to start asking her some different questions. And I say her because most of them are women, but that's what I would do, is be proactive. I heard somebody talking about the need to test for the pathogens in my mouth because I have some heart disease and I want to heal that. I don't want it to get worse over time.
Yeah.
And so I think, asking your hygienist to partner with you and help you manage those risk factors. And as a patient, tell them what you value. I want to get healthy. If she doesn't ask that particular question, then you tell them what the answer to that question is. And just be proactive and be an advocate for yourself, and listen and learn from friends that are seeing a great hygienist that is more interested in oral systemic health than tartar removal. That'd be a great place to start. But they can also reach me on my website. I'm surprised it was up because I'm having it redone. So
I was on it. It's still there. They haven't taken it down for construction yet.
Well, I'm adding a patient portion.
Oh, perfect.
Yeah. So the second patient I saw in hygiene school was my husband's grandfather.
Oh my goodness.
And I found on him what turned out to be oral cancer.
Oh my
And
goodness.
I realized at that point that every single person that sits in my chair has a plethora of people that love that person and would want me to take absolutely the best care of them and find out through my life-saving screenings anything that could impact their health span.
Yeah.
And so that to me is the purpose of a hygiene visit. And I've developed a way to get patients from what I call the danger zone when they have risk factors to living in the safety zone where we mitigate those risk factors. Now, do I do all this by myself? Absolutely not. But I know the questions to ask. I don't have to have all the answers. That's when the doctor that I worked for would refer to somebody that, to a certain physician that had greater knowledge. And, I don't want hygienists to be afraid of painting that bigger canvas for their patients, because you don't have to know all the answers. You just got to ask some great questions.
And you know what? That's very true from that perspective, because I find that a lot of times people are afraid. I mean, none of us have all the answers. Even in what we specialize in, we don't have all the answers, right? We don't pretend to do that. But at the end of the day, we always have the next person that can help kind of bring more clarity to the table and new ideas and things like that. So, yeah.
When I was in hygiene school, I graduated academically #1 in my class. And you can imagine, I thought I had all the answers. But what I realized after about 28 years, it started to dawn on me, it didn't matter if I knew all the answers. What I needed to know was how to shift and ask better questions, because the quality of your questions determines the quality of your service and what you're able to do. So,
yeah, it's an amazing takeaway. Amazing takeaway. Well, and so we're going to have all the links to your websites and where people can find you. And obviously, and so give me a little background too, just with regards to, so the book, I know it, you're still in the midst of writing. Yes.
Well, we're rewriting it. So
Okay.
because, yes.
Okay. And so what's the, I don't want to say a launch date, but sometime maybe later in 2025 kind of thing, we'll look for this, or?
It should be out by the first of the year.
Oh, yay.
But
That's wonderful.
if I can just say one thing,
Mhm.
the experiences that I had by the time I had turned 18 really started my journey into compassion. And, compassion is nothing more than empathy
Mhm.
plus action.
Like it.
And so because of what we know about people and how many people are around that love and care about our patients, we just have to shift from the tartar removal to oral systemic health and have enough compassion for others to be willing to figure out a way. And I've broken the code on the time problem. Most hygienists will say, oh, I'd love to take care of my patients that way, but I don't have the time. I broke that code. So I have plenty of time, because once you shift your patient from the danger zone into the safety zone, the great thing is you don't see calculus or tartar anymore. And so you have plenty of time in your visit to do those life-saving screenings. And that's what increases your service mix in your practice, is finding those things that need care.
Yeah.
Taking care of.
Absolutely.
Yeah.
Amazing. Amazing. Well, so much great information. And again, I think you posed some very good questions for our viewers and listeners to be able to bring to the table on their next visit, and really dive in and ask those questions, right? To become a partner and to help with those health situations, and even more critically important, ask about their values and also do some of that pathogen screening, because again, you're right, it all comes back to inflammation. And it's not just about, people have gut issues, GI issues, and, all these things, they're paying attention to that, but they're not paying attention to what's going on up here, because maybe they're not also paying attention to the symptoms that might be part of it as well, right?
People pay for gym memberships and they pay for all kinds of stuff, massages and stuff. But you talk to a lot of those people and they go, oh, I haven't been to the dentist for 3 or 4 years.
Right.
And, if you want total body health, you gotta wake up one day and realize that's a part of your health that you're ignoring. So
Absolutely. A big part of your health you're ignoring, right? Yeah, absolutely. Absolutely. Well, I'm excited for your book, The LifeGuard Approach, hopefully coming out beginning in 2025. Look for that. We're going to have all of Chris's links below so that you can find her if you have questions. Obviously, she's got a brand new website coming, so that's amazing as well. And I just want to say thank you for taking the time to join us and to share, especially your story. It's always so interesting to hear, your journey and kind of what brought you into this realm of, again, compassionate care that you've been practicing for so long.
yes, thank you so much for having me on today. And I appreciate the opportunity to share what I care about, and that's saving lives. So
Absolutely. Absolutely. So for those of you watching on YouTube, thanks so much for tuning in. Make sure you subscribe to my channel. There's a brand new episode on every 2 weeks. And if you're watching on your favorite podcast host, make sure you give this episode a like, and we will see you next time. Thanks for joining us today on the Human Optimization Podcast. Episode technical production is by Grace Sylvester and guest booking by Stu Tate. Want to learn more? Visit Pitel-Killah.com for incredible free resources to supercharge your journey to becoming the best version of you. If you enjoyed this podcast, please like and subscribe to the Human Optimization Podcast and follow me on social media at Pitel-Killah.